And more now on our breaking news, the death of the first Ebola patient diagnosed in the U.S. Thomas Eric Duncan died this morning in a Dallas hospital. Joining us now, infectious disease specialist Dr. Frank Esper from University Hospital's Case Medical Center. Dr. Esper, thank you very much. Is there any way to determine whether it was the delay in his treatment that led to the fact that he died? There's no way to know how infected he was initially and how serious his case was initially when he first sought treatment.
Yeah, unfortunately, this is one of the things that worries us most as a physician. And I've been down in the emergency departments, but anytime we see any patient, the first thing we try to figure out is how sick are these individuals, and are they at risk of getting worse? And sometimes it's very difficult to tell that when someone just shows up with these very non-specific, my stomach hurts and I'm vomiting a little bit. That could be very, very bad, or that could be absolutely nothing. It's just a bad virus and you'll be better. Unfortunately, it's going to be very difficult to tell whether or not earlier therapy would have helped this poor man, because unfortunately this disease, this infection, has such a high risk of death that we don't necessarily know that it would have changed even if he would have been admitted the first time.
Perhaps we have been lulled into some sort of sense of false security by the fact that Dr. Brantley and the others who had been the aid workers in Africa had survived and had fully recovered. So we've had that experience so far, and this is the first time that we're dealing with the mortality here of one man, and admittedly one man when more than 3,000 people have died in West Africa.
Yeah, but this is also the opportunity that shows exactly what the best, when we give world-class care and we have the ability to give meticulous attention to the body's ability to clot, when we're able to support a person with some of the best machines and some of the best medicine that we have here, even despite all that, it does show that people can succumb to this infection. And I think that's what's most alarming to everyone. I mean, we do know how hard and how tough that they have it over in West Africa, but we feel that if we can get them here to the United States or to any of the industrialized areas where they have some of the best medicine, that people have a very good chance of surviving. And we still just don't know that. Unfortunately, we are still learning on the job outbreak, and that's obviously the worst time to try new things and to try to figure out what's going on. But certainly this individual received the best care that they can from what we do is we call it supportive care, when we're supporting their fluids, when we're supporting their blood levels and their ability to clot. But unfortunately, sometimes it's just not enough.
Sadly, in fact, in this case. Thank you so much, Dr. Frank Esper from Cleveland.
Very good to you.
And still to come, the former director of the